So it's a proud moment for all of us as a part of Dr. Bhatia Medical Institute that Dr. Ashir is with us. Dr. Ashir secured rank 5 in AIIMS November 2016 exam. So I would like to say congratulations to
Thank
Dr.
you so
Ashish.
much. Thank you so much, sir.
Right. So how are you feeling right now?
First of all, I would like to thank Dr. Bhatia and each and every faculty here for inviting me, to talk. I'm feeling amazing. I can still not digest the fact that I got rank 5. My AIIMS paper went okay. I was pretty confident that I'll get a good rank, but rank 5 is a little unbelievable for me. Still, I'm just recovering from that.
Right. Hard work always goes, right? You must have
Yeah, it does indeed.
Right. So it was your first attempt here.
This was my first attempt.
Okay, you are still doing your internship.
I'm still doing my internship.
Right, that's good. So can you please guide our students like how to prepare for this PG entrance exam? Like you're doing your internship and still you have cleared this exam. So many students get confused how to prepare for this exam. So can you please guide in short?
PG entrance exam is I don't think it's a 1 year preparation that you need. It's all the years that you have spent in your MBBS, they all counts one way or the other. I mean, something you heard or learned in second year would come up as a question and you would recall it. It's not always that what you read in internship will be asked. So in my case, I was pretty focused about the AIIMS exam. I did not focus on PGI or NEET. So as far as AIIMS was concerned, what I had asked my seniors and what I knew, the questions that are asked in AIIMS are actually based on what we do in our first and second year. Practicals, slides, images. They are not very difficult or very complicated images. They are simple images, simple stool samples, simple X-rays. So all you need to do is be thorough with your preparation in first, second, and third professional examinations. Right. If you are good, your base is strong. All you need is a little brushing up in internship, which is not a big deal to do.
Right. That's good. So it means, according to you, this preparation should be started from first year itself.
Yeah, I don't say that you keep on reading PG books, you do MCQs right from day one and you focus PG entrance examination. What I'm saying is you focus on your studies really well. Right. If your basics are clear from first, second and third year subjects,
then things will be easy.
Then things will definitely be easy and you'll not have hard time remembering facts and stuff because they would already be enriched in your mind.
So if a student is not from Delhi, from some other area, and if student is not from a good college, like from private college or some other college, and if he wants to take help of our institute, so in which particular student should join the coaching? Any idea? And can you give opinion for this? Which year is the best year for the student to join this institute?
I think it is better that the student join as early as possible. I mean, I would not recommend in first year because they have already entered into this MBBS and already from 2 years of coaching for their PMT entrances. But yeah, once they are in their pre-final examination, the foundation year, the 6th and the 7th sem, I think that's the ideal time to join.
Right. Like you have just mentioned, these days in AIIMS exam, they are asking about these pathology slides, like stool samples and all. And these subjects are from second year, like microbiology and pathology, right? So don't you think the student should join into the course from pre-foundation batch?
Yeah, if they can manage their studies, their second professional exams with the coaching, definitely. I mean, it's not a bad option.
So if join in pre-foundation batch, it means
definitely going to help them. Right. Preparation at any stage of their life is going to help them.
Right.
So they can, and anywhere they can start studying and learning, I think it's not going to be a problem.
Right. And Dr. Ashir, how was this AIIMS exam this year?
AIIMS exam this year?
So how is it different from the previous year's exams?
From the previous questions that I did from the past year papers, I think
this time from those guides and all, like questions which are given in guides and the previous.
I don't think they ask repeat questions anymore.
Okay.
I don't think there's a trend of
asking repeat questions.
The topics might be remotely repeated in the papers, but like it used to be, I think 5 or 6 years down the line, that question used to, as it is, come from previous question. I mean, the same question, same options was there in papers. All over again.
5 years
I mean that era is long gone. This time the questions are simple, they are not very difficult, but they are not repeated.
Okay. So more practically based, like
more practically based, definitely. The questions are actually clinical case scenarios. There are very few one-liners, very few questions based on. Even in a subjects like pharmacology, where people create this hue that you have to remember each and every drug and fact, the questions that there are based on clinical scenarios. So there won't be one-liners like most common this, most common this. And I would like to say questions जो वो trend होता है ना, most common cause, they are hardly ever asked in AIIMS.
Now they have stopped asking.
They have stopped asking these classical most common questions. They are just clinical images, pathology slides, X-rays, clinical case scenarios, ignitated. They are all asked.
Okay. So like you have joined our institutes and our teachers taught you all these things. So, have you got any help from our teachers in this aspect? Like they taught you something clinical and so all these things?
Definitely,
so
most of the teaching that I had in Dr. Bhatia was clinically oriented. I mean,
Right.
that's the actual difference between Dr. Bhatia Institute and other institutes.
Right.
Dr. Bhatia Institute के अंदर the TND that we had, they were not bothered कि हमें we have to teach them 10 things or 20 facts or 30 facts. They focus on one or two few important topics that are asked, and they go into the depth and teach you the concepts.
Right.
So in other places people go to a lot of different coaching institutes, and mostly they keep on mugging facts, most common this, that. I mean, that kind of teaching is not done in Dr. Bhatia Institute. It's basically focusing on concepts.
Right.
So if you know one concept, you'll be able to solve 10 questions.
So as a student, which teachers inspired you most?
I think Dr. Arora,
Dr. Arora,
pharmacology, definitely. I mean, I was really, it was the first class that I had, and I was really, I was really impressed, and I thought, yeah, I have done the right thing coming to Dr. Bhatia.
Right.
And then I would really like to thank Dr. Arora for surgery. I think he's one of the best teachers that I've ever had.
Right. And what about our Dharma sir and
yeah, Dharma sir, I was actually talking about him. Dharma sir, it sounds unbelievable, but he was actually able to complete the almost 99% of dermatology in a 4-hour session.
Right.
So in that way, and the class was not monotonous, it was not tiring, it was so interesting, and the way he did it is totally unbelievable.
Okay. And what about the quality of visuals which we have shown in our classes?
The quality, yes, the visuals that are shown in Bhatia Institute, I think that's all we need to do, because it is not humanly possible for a child in internship or anywhere to memorize thousands and thousands of images, because there are 19 subjects and it's not a easy job to do. So whatever images are focused, the images that were taught to me here in Bhatia, I think those are pretty much sufficient for preparation for AIIMS at least.
Okay.
I would like to say.
So it means the student should start preparing as soon as possible.
As soon as possible, yes.
To start from second year, it's better to start from second year.
If they're comfortable, definitely.
And it's better to join some institute instead of studying my own.
Yeah, because when you join an institute, you're in an environment of competition and preparation. Exactly. Even if you're not able to read as much, you'll be in a trend and a habit of reading. Right. So it's always better to be under guidance. It helps you prepare better.
Good. And which stream you have decided to take?
I am really confused right now. I am still exploring my options.
Right.
As soon as I know, I'll let you know.
Okay, Chalo. That's good. That's really nice talking with Dr. AASHIR. And according to Dr. AASHIR, students should start preparing for PG entrance exam as soon as possible. It's better to start from pre-foundation, like from second year, because now these days they are asking questions from pathology, microbiology, as well as from other paraclinical and preclinical subjects. And I also advise other students that they should concentrate on your clinical posting, because whatever they see in day-to-day basis, like whatever clinical cases they are seeing and whatever things they are studying in their
wards
concerning years. So that is also important, because somewhere these things will come again in your exam. So you can clear those things easily. Right? So concentrate on your studies, and I'm really thankful for Dr. AASHIR to come and give
all the thanks to you. I'm really pleased you called me here.
Right. Okay, Dr. AASHIR, nice talking to you.
Thank you so much, sir.
Congratulations once again.
Thank you so much.